Hello students, I am Dr. Trupti Ramteke, Assistant Professor, Department of Biochemistry, St. J.S. Medical College and KM Hospital, Mumbai. In this bioethics session, which is a part of foundation course, we are going to learn about cultural diversity and cultural competence. The competencies demonstrate understanding and respect of cultural diversities and interact with those with different cultural values. At the end of this session, students shall be able to describe cultural diversity, describe dimensions of culture in healthcare, and describe components of cultural competence. What is the need to understand cultural diversity and cultural competence? William Osler rightly said that the good physician treats the disease, the great physician treats the patient who has the disease. So if a physician wants to treat his patient, then he must understand his patient well, and that process of understanding patient should go beyond diagnosis and treatment, and for that communication with the patient, building trust and establishing rapport is the crucial steps. And we know that cultural factors impact health, and if we don't understand the culture and various cultural diversities, then we can't treat the patient well. And we also know that doctors are actively taught to be neutral, gender neutral, cultural neutral, and this neutral stance has been responsible for culturally incompetent medical practitioners and culturally insensitive practices. So to break these barriers, we need to understand cultural diversity and acquire cultural competence. What is culture? Culture is a way of life of a group of people, the behaviors, beliefs, values, and symbols that they accept and that are passed along by communication and imitation from one generation to the next. And this culture includes various beliefs and values, religion. The culture is it differs from religion to religion, region to region. There are various customs associated with the particular culture. There are many languages. So according to the language spoken, there are different cultures. It also differs with the socio-economic status. So these are the various facets of culture. India is a nation with cultural diversity with respect to the religion, languages spoken, food habits, and rural urban area, that is region with socio-economic status. In India, there are many religions like Hinduism, Islam, Buddhism, Christianity, Sikhism, Jainism, and every religion has their own beliefs, values, and traditions, customs. Even there are various languages spoken in India, and there are 22 major languages and 720 dialects. The food habits are also varied. They are different from region to region, religion to religion. The culture in rural area is entirely different from culture in urban area. So we need to have certain idea about the cultural means practices of the various religions and about their impact on the health. Every state in India has their different culture, civilization, and their traditional clothes. By looking at the picture, you can easily make out which couple belongs to which state. So we have the diversity in traditional clothes and fashion culture also. The beliefs related to birth are different in different religions. For example, in some religions, contraception is not allowed. In some religion, abortion is considered as sin. Childcare practices are different in different religions. The customs, traditions related to pregnancy are different in different religions. Even in the particular religion, as per the sects, the customs are different. When I was working as medical officer in one of the primary center, then I saw there was one particular group of people. They were the follower of some Baba, and they used to follow seva for 1 month, and during that period, even if the patient is ill, that person was not consuming any medicine. So the person was prohibited to take the medicine, and this can even though they know that this can impact their health, they were not allowed to do this. So this is because of their belief that if they are doing seva, nothing can harm them. So there are different beliefs which can impact the health of patient in different religions, different sects, different sects, and different regions. There are various menstruation beliefs which can impact the health of a woman, and there are various beliefs regarding the organ donation. In some religion organ donation is allowed, in some religion it is not allowed, because it is believed that if a person donates his or her organ, then he cannot attain salvation. The beliefs around the mental health are also different. The mental illness is considered as a, means like a sin of last birth. So there are different beliefs which impact adversely the health of a patient. The beliefs at the death are also different in different religions, and the doctor must keep in mind the religion of patient while taking care of end of life issues. For example, in Hindus cremation is allowed, in Muslims cremation is not allowed. The funeral practices, their rituals are different in different religions. So one must be aware of these differences across various religions while treating and handling those patients. What is cultural competence? Cultural competence is not only the understanding and awareness of cultural diversity, it is the attitude, skills, knowledge, and behavior required for a healthcare provider to cater optimum healthcare and services to the patient. And in the multicultural society, there are various cultures which are based on the ethnicity, sexual orientation, geography, gender, religion, class, socio-economic status. So there are multiple cultures. So respecting cultural diversity and considering this aspect while dealing with the sick person should be integral aspect of practice of medicine. And the healthcare provider must be able to effectively and respectfully recognize, protect, and preserve the cultural ethos and dignity of patients. Equality, equity, and justice are the important principles of bioethics. Equity recognizes that each person has different circumstances and allocates the exact resources and opportunities needed to reach an equal outcome. So, for equality and justice, equity is very important, and cultural competence is a way to achieve this equity. Cultural competence is the continuum of respect, empathy towards patients to provide them optimal care by reducing health disparities arising out of cultural beliefs. And this continuum, it is a six stages continuum that explains the unhealthy and healthy values and behaviors of persons, policies, and practices of organization. The first three stages, that is cultural destructiveness, cultural incapacity, and cultural blindness. These three stages, they show cultural incompetence, while the last three, that is cultural pre-competence, cultural competence, and cultural proficiency, these are positive cultural competence. Now what is cultural destructiveness? These are the attitudes, policies, and practices those are destructive to other cultures. Dehumanizing of other people, assumption of superiority. For example, the rights and privilege of dominant groups are only considered, rights and privilege of other groups are neglected. What is cultural incapacity? In the cultural incapacity, there is suppression of other cultures unintentionally, creating fear and assuming a paternalistic approach. So, in this cultural incapacity, racism, casteism is favored, stereotypes is maintained, and unfair practices are done. So, and the third is cultural blindness. Cultural blindness, in this cultural differences are ignored. The policies treat everyone the same. And this approach is detrimental as it gives justice only to culturally dominant groups and injustice to the minority culture. And this is the positive continuum of cultural competency, that is cultural pre-competence. In this, the cultural issues are explored, needs of individual and organization are assessed. Then what is cultural competence? Here, the individual and cultural differences are recognized. Advice is sought from diverse groups, and in the organization, unbiased staff is hired. So this is a cultural competence. And the last is cultural proficiency. It is the ability to build strong cross-cultural relationships through effective communication skills and developing skills to interact in diverse environments. So here The It is to implement changes to improve service based upon the cultural needs. So this is the cultural proficiency, and this is the continuum of cultural competency. There have been some philanthropic institutions and doctors working for the welfare of the rural populations in India. They could successfully mediate cross-cultural conflicts and revolutionize healthcare for the poorest people of India. And one of the initiative is Life Saving Dot, that is Jeevan Bindi. Nilvasant Medical Foundation and Research Center Nashik, along with the Grey Group Singapore, initiated this Life Saving Dot program for the women in rural areas of Western Maharashtra. And the women in this area, they were fighting iodine deficiency, and they were provided with a standard scarlet bindi having adhesive covered with 150 to 200 microgram of iodine, and it works on transdermal dispersion methodology, wherein a woman wearing the iodine bindi absorbs on average of 12% of their daily requirement of iodine. So this is one of the example of cultural proficiency. Dr. Rani and Abhay, they have been working in rural tribal district of Maharashtra Gadchiroli through their non-profit organization Search since 1985, and their practice is based on demand-driven healthcare by asking the people what they want and what are their major concerns in the summits organized by them, regularly called as People's Health Assembly. And these tribal people, they have the fear of big buildings and they feel lost there. So they also think that the doctors and nurses wearing white coats and dress are like ghosts. So how can they save such sick people? So this Bung's family, they therefore build their hospital as small huts, keeping in mind the cultural beliefs of people. And when Bung started to work, infant mortality due to pneumonia was a major concern of people. Cultural beliefs, fears, and lack of trust in modern healthcare facilities were affecting the health of the baby and mother. After the delivery, newborn and mother were confined in a small, dark, damp room, and they were not allowed to leave that room for 1.5 months to prevent the catch of evil eye. So this belief prevented the newborn baby from availing treatment from a medical practitioner or hospital for any illness. And this cultural belief led Bungs to think differently, and they created a home-based package of neonatal care that would be delivered by a meticulously trained and equipped village women called community health worker. And the infant mortality rate dropped from 121 per thousand live births in 1988 to 30 per thousand in 2002. And that's why WHO and UNICEF endorsed their approach to treat newborn babies at home. And this healthcare revolution model is being implemented in India as well as in the Bangladesh, Nepal and many African countries. The other example is Dr. Mandakini and Prakash Amte. They started Lok Biradri Prakalp in 1973 for integrated development of Madia Gond, the primitive tribals of Bhamragad in Gadchiroli district of Maharashtra. The Amtes overcame the language barriers by learning local media language. Dr. Prakash Amte also started wearing half pant and vest to be one of them. They went from village to village in search of the sick people. Madhyas would not accept medicine from them because they had more faith in the local quacks and believed the witchcraft and mantras. It took a long time before they believed in them and started to seek medical help. Amtes also built residential schools for children of tribal people, and they received the 2008 Raman Magsaysay Award for Community Leadership for recognizing and enhancing the capacity of the Madhya Gonds to adapt positively in today's India through healing and teaching and other compassionate interventions. Dr. Smita and Ravindra Kolle, they have transformed the lives of tribals of Meghat in Amravati district in Maharashtra. They have improved health outcomes in the area and helped the villagers to gain access to electricity, roads and primary health care. They identified the root cause of death was malnutrition and poverty. So along with successfully treating the disease, Dr. Kolle learned about veterinary science from a friend and studied agriculture also. He then developed fungus-resistant seeds and organized various camps to raise awareness about new farming techniques. They themselves started farming to set a role model. This revolution in farming techniques helped villagers to fight with the root cause of problem, that is poverty. And the couple believed in teaching people to catch a fish rather than giving them a fish for life. Another couple is Dr. Kavita and Ashish Sato. This couple has been working in the tribal regions of Meerut for 20 years through their trust Mahan. They have been working to reduce the mortality rate in reproductive age group due to various causes like malnutrition, anemia, tuberculosis, pneumonia, cataract, hypertension, and heart diseases in tribal people, and they adopted around 100 villages where the death rate was reduced by 50%. So these are the various examples of cultural proficiency which changed the lives of thousands of people who were deprived of healthcare facilities. How cultural competence is acquired? There are various skills of cultural competence. For example, knowledge base. The healthcare provider should be aware of his or her own cultural beliefs before understanding other cultures and its implication on healthcare of individual. Respecting similarities and differences in beliefs and involving the patient into decision, it is very important. Is it possible to know all the customs, traditions, values and beliefs of every religion, region? No, it is not possible. And in that case, we should ask the right question, considering that everyone has its own values and that his or her culture can be different from ours. Our opinion, our values can be different from others. So respecting others' culture, other opinion is very important. Language. Second is language. Using simple, understandable dialect or effectively using an interpreter is helpful because clear communication between the doctor and patient is very important for exchange of vital information. Physical interaction. Non-verbal communication in the form of physical interaction exists in relation to the eye contact, touch frequency and gesture. So body language should be considered. So what is the first important step? We should always ask right question. We should have sensitivity towards the personal beliefs of others, the language barriers. The body language is very important. We should always consider the gender, socio-economic status of that patient, disability and sexual orientation as well. So if we keep all this mind, we have these skills, then we can acquire cultural competence. Cultural competence is a process, not an event, a journey, not a destination, dynamic, not a static. It is not possible to have all the information about diverse cultural health beliefs and practices. So asking the right questions carefully can be useful to reveal the cultural attributes of health. That's why 4 C's of culture is very important. This mnemonic was developed by various doctors like Stuart Slavin, Alice Keogh and Gary N. And this help clinicians to remember what questions should be asked to patient in order to get their points of view. The first question should be, what do you call the problem? Means what do you think, what is wrong? And this question helps in understanding patient perception of the problem. Second question is, what do you think caused the problem? And this question helps to be aware of patient beliefs regarding the source of problem. Third is, what have you done to cope up with the problem? For example, home remedies or any traditional healers. It helps to find out what patient has done to improve his condition. And the fourth question is, what concerns do you have about the problem and the recommended treatment? It is to find out how does the problem interfere with patient's ability to function and what is the patient perception about recommended treatment. So these 4 C's of culture are very important to acquire cultural competence. This learn model is given by Berling and Fox for acquiring cultural competence. How you deal with your patient? You have to listen to the patient's perception of the problem, explain your perception of the problem to the patient, acknowledge and discuss the differences and similarities, recommend the treatment and negotiate the treatment. So this is the learn model for acquiring cultural competence. Cultural competence is the continuum of respect, empathy towards patient to provide them optimal care by reducing health disparities arising out of cultural beliefs. So this cultural competence, it is a continuum which starts from extreme humility to the extreme openness or acceptance, and it requires awareness of our own biases and prejudices towards other culture which can be achieved by regular self-assessment. So let's ask ourselves some question to assess our own biases and our own prejudices. So let us ask this question to ourselves to understand our own biases and prejudices. Do I make opinion about the people on the basis of language they speak? Do I attempt to learn the regional language where I live and use keywords in the language so that I am better able to communicate with local people? Do I avoid imposing my cultural values and beliefs on others? Do I intervene in an appropriate manner when I observe other people engaged in behavior showing cultural insensitivity, racial or casteist biases and prejudices? Do I understand that age, experience, gender must be considered in interaction with individuals and families? Do I judge people by type of clothes they wear and how they look? Do I believe that people living in rural area are gender biased and engaged in superstitious activities? Do I seek information from people to understand the beliefs and values of other cultures than my own? So while doing this self-assessment, try to be honest. Give all the honest answers to yourself and try to find out in which area you are biased or prejudiced. Try to overcome that bias. And this is not a one-time process. This acquiring cultural competence is lifelong endeavor. It is not a destination. It is journey, and that this self-assessment is regular, which should be done on the regular basis. So in this video on cultural diversity and cultural competence, we understood that a healthcare worker with a strong personal identity who is aware of his or her own strengths and weaknesses and who along with his knowledge base and sensitivity of different cultures can make a difference to the lives of their patients and will be able to accomplish cultural competence. We also learn from the exemplary work by the doctors mentioned in the video that the ability to understand the differences across cultures in relation to health and finding ways to tackle may be challenging but not impossible. As said by the Audre Lorde, that it is not our differences that divide us, it is our inability to recognize, accept and celebrate those differences. Thank you.